Self, which is an involuntary process. Associate Clinical Professor of Surgery, Dr. Dabney Ewin.
There was some very good laboratory work done in 1959 showing that there were two parts to a burn, that the actual injury to the tissue that occurs from the heat, and then the body's subsequent response to this producing an inflammatory response of pain and swelling and blistering. Ordinarily, this kind of swelling will continue over a period of 2 to 3 weeks when the man cannot make a full fist.
Dr. Ewin started to use hypnosis with his own patients in 1968.
My first case was an alcohol explosion. It burned the man's face, burned off his eyebrows. Here he is at 31 hours. And if you follow the ordinary progression of a second-degree facial burn, starts from the time he's burned and there's tissue damage to the face. Within 24 hours, there's a severe inflammatory reaction with marked swelling so that they all look alike. They're big moon face, and the eyes are swollen shut so tightly that you can't even pry them open enough to examine the eyes for several days, on down to 6 weeks when he's healed. I saw this patient in the emergency room and hypnotized him about a half hour after the burn, gave him the suggestions of being cool and comfortable. When I saw him at 31 hours, he was completely comfortable, had not even asked for an aspirin, although he knew he could have Demerol or morphine. He could open his eyes completely, and there was just none of the signs of swelling and inflammation that usually occur as a reaction to this kind of stimulus. He progressively healed very easily and comfortably, and here he is on the 14th day, completely healed when I let him return to work. Particularly, you can notice that his right upper eyelid still has some residual of the burn on that eyelid, which should have closed that eye. The mechanism in burn seems to be that the stimulus sends a message to the central nervous system that calls for a response and a reaction, and that if you get to them within the first 2 hours before the response has been released, you can block the response and in effect have them react as though they had not been burned as far as having an inflammatory response is concerned. Here's a man who had an acetylene burn of his right arm. Acetylene burns at 3,000 degrees centigrade, and the hose broke and simply charred this man's forearm and his shirt. I saw him about an hour after the accident and hypnotized him, dressed his burn. He went back to work. I saw him at the plant the following day, and here he is at 21 hours. And while his skin is all charred, there's no swelling. He was not in pain, no sign of infection. And in 8 days, he's really almost healed, and in 12 days, it's completely healed.
What do your colleagues say about this?
The ones who do hypnosis are not surprised. The ones who don't are surprised and tend to believe that the patients simply weren't burned as badly as I have projected. And the test of this, of course, has to be with controlled studies. And they're beginning to be done now. The early results indicate that you can prevent the inflammatory response to the stimulus from the burn.